if we can really cultivate a psychologically safe and healthy workplace, we're not only going to have individuals who are good in a work capacity, but then they go out to their communities, their families, their friends, whatever, all the other domains of life, and they are going to be healthier people, and they're going to... What does it mean to be a psychologically safe and healthy workplace? Well, the answer is complex and is the reason I'll be spending another 3.5 years researching this topic. The public health crisis of COVID-19 has really underscored for a lot of us the importance of mental health and truly understanding what needs to be done to cultivate happy, thriving individuals. So in today's episode, we're going to discuss this topic, but before we jump into that, I'll throw over to Amanda for the formal introduction and just to summarize the 3 topics that we want to discuss.
Yeah, absolutely. So this show is for anyone out there who feels like they've settled for an unfulfilling life. Whether you've settled in a relationship, the work that you do, or just how you feel about yourself, we're here to tell you that settling is not an option. If you like the show, please follow us on Spotify, Amazon Music, or you can subscribe to our YouTube channel. If you have any feedback about the show or would like to offer a recommended topic, you can email us at cheerstonotsettling@gmail.com. Finally, to conclude the plug, if you feel so inclined, you can donate as little as $1 to us over at Coffee. There will be a link in the description to do that, and that can help us just improve the show, get some new equipment, and we're hoping to just break even. That's our only goal, it really is to break even with the show because there are costs involved. So we appreciate that. All right, so the 3 questions we will be discussing today are: why is creating psychologically safe and healthy workplaces important? What does the best practices approach to improving workplace mental health look like, and why is this framework so difficult to implement? And last but not least, if an organization wants to implement a workplace mental health framework, where should they start? So, all right, Adam, I'll let you take it back over with that first question there.
Excellent. Okay, so thank you for that. The first topic is why is creating psychologically safe and healthy workplaces important? So I'll start the timer. All right, so I could talk about this for ages, but let me just summarize some important points. The first one for me would be, it's the right thing to do.
Mm-hmm.
So I heard somebody on another podcast a while ago say, whether you're doing this for altruistic reasons or business reasons, the output is the same. You're going to have happier, more productive employees. And that's the big thing, I think, to start with numbers.
Okay.
That mental illness in particular, there's over 1 billion people on this planet right now that are experiencing some kind of mental illness. And that was a figure from the Lancet, I think, back in 2019. So who knows what those figures look like now because of COVID.
Yeah.
But, it's a lot of people struggling, and that's just talking about people that are struggling from mental illness. It's when we really come to understand things like psychological distress, or people that are languishing, which is a term used to say that you're not experiencing illness, you're just not, you're not experiencing mental well-being.
So when you say illness, when you say illness, you mean like something that has been clinically diagnosed.
Yeah.
And then it's reported in some system where they can come up with a number. Because there's so many people that maybe even have a mental illness and wouldn't get counted in that number because nobody knows about it.
That's it, yeah. And that's a really important thing too, because, some people might not feel comfortable disclosing their feelings or seeking help. And so that's like one of the biggest things actually in the field is how can we get, especially men, I think, and especially men in Australia. I'm not sure what it's like in the US, but just getting men to seek help so that they can have that clinical diagnosis if it's necessary and, start to receive treatment. But that's the thing really is it's like, you can put a label on it. You can talk about depression or anxiety, or more complex things, bipolar, psychosis, things like that. But there's a lot of people, I guess, right now who are struggling. So it's, as a people priority, this is absolutely paramount.
Right.
And then from a cost perspective, these figures I'm pulling are from 2017, so they're a bit old. And in the academic world, we don't like when it's too old. But the World Economic Forum said that the cost of mental illness related costs for the world is about 2.5 trillion US dollars.
Yeah.
So that's a lot of money.
Yeah, I mean, you can't even begin to imagine how much money that is.
Yeah, so it's huge. So if we look at it, we move away from the altruistic reasons and the fact that it's the right thing to do. It is very expensive. But I just think of it practically like this. We're going to spend most of our waking lives at work.
Exactly.
So, if we can really cultivate a psychologically safe and healthy workplace, we're not only going to have individuals who are good in a work capacity, but then they go out to their communities, their families, their friends, whatever, all the other domains of life, and they are going to be healthier people, and they're going to cost a lot less. So, it just, to me, it seems like a no-brainer, but at the same time, I get why it's hard to do. But yeah, when we specifically talk about work, because those costs I was talking about before, that's mental illness in general, as a global cost for countries. In a work capacity, you think how much of an impact people with mental illness or psychological distress have on components like absenteeism.
Yeah.
Another one which people wouldn't know as much about, but it's called presenteeism.
Yeah, I had never heard that until I saw the show notes, and I'm like, that's really interesting. I really like that. I don't like the idea of it, but I like that it has a name because
and it's an interesting one, and it's difficult to quantify as well. Some people have a problem with it because how can you quantify? For people who don't know, presenteeism is all about being at work but being less productive because of an illness or your psychological distress. And that's difficult to quantify because you're dealing with people. How can you work out what's lost and what isn't lost? But anyways, it's a thing, and it's been researched.
We all know we've experienced that. Everybody's experienced that before.
Yeah. Where you come to work. Yeah, exactly. You come to work, you're probably running on about 50%, but you're like, I'm here because I'm trying to help out my, my team, or my boss needs a hand or whatever, and that's presenteeism. And then other costs like, voluntary turnover, like myself, I chose to leave my last place of employment because it wasn't psychologically safe and healthy. And also other costs like workers' compensation. So again, I'm not sure of the stats in the States, but over here, the cost of a workers' compensation claim because of psychological injury is about $85,000. So it's a lot. And also the time that the person is out of the business is a lot longer than if they've had a physical injury.
Right. I wonder, I don't know, maybe somebody could tell us in the comments, somebody who's listening and watching, I don't know if you can claim workers' compensation for that in the United States.
Interesting.
I don't know. I'd be curious to know. Maybe you could. I mean, it seems like you would be able to if you had obviously something from a doctor or a psychiatrist. I don't know what it would be, but whatever. I don't know what the difference between a psychiatrist and a psychologist is. I always get those mixed up, but
yeah.
It sure seems like if they signed off on something, you could, but I don't know, or if it has to be a physical injury.
Well, that's an interesting one because just doing, a little bit of research on like legislation in different countries, the US doesn't have any like specific OH&S legislation on this issue. Occupational health and safety legislation.
Okay.
Like you guys have, the Center for Disease Control, and they've got like a part of that, which is it's just called the NIOSH, which I think is the National Institute for Occupational Safety and Health.
Okay.
And they basically will, have different programs for workplaces, but there's no specific like regulation or anything in that area, which is odd because the US is such a big country.
Because we have a similar thing at the state level that's called OSHA, Occupational Safety.
Oh, yeah.
But that's physical safety. As far as I know, that's all physical safety.
Yeah.
That is interesting. I don't think we do. I mean, I don't know. Maybe there is something, but I've never heard of anything where there's any kind of program like that for mental health.
Yeah.
Yeah.
But it's interesting, and it's true for a lot of countries. I think it's only, some countries or members of the European Union are the only ones with like clear regulation.
Okay.
Australia is certainly getting there where, we should hopefully be there in the next, I don't know, next couple of years, maybe. But yeah, lots of other countries
Yeah,
all over the
we're
world
not,
have
we're not
no
getting there anytime
regulation.
soon. I don't think
Yeah,
we're getting there anytime soon. So
no. So it's a very interesting topic, but I'm mindful that I've dumped a whole lot of information, which to me is, I know I like the back of my hand, but I'll pause now and allow you to maybe just chat about some of those things.
All right, sounds good. Hey, I would listen to you because it's interesting to me, but
Thank you.
but I did have a couple questions because
Mm.
I was wondering too if you looked at in your studies or your work that you're doing, because you talked about the costs, like the financial costs of people being absent from work and not being as present when they're at work and all that kind of stuff.
Mm.
So there's like dollar costs, but the other side of it that's too you can't really measure is all the costs of to the company as far as being able to grow. Because
Yeah.
it really limits a company's growth because when people are in a bad mental health state, they're not going to be as creative, they're not going to be as innovative, they're not going to be delivering good customer service. And so all those things too impact the financial health of a company and even their sustainability because you have to remain innovative in a competitive market. If you're not innovating, your competitors are going to take you over. So I just wonder, are those some considerations out there too?
100%. Yeah. And it's an interesting question, that one, for a couple of reasons. So from what I know, there'd be two components. Like when people are like depleted, their resources are depleted because of, the workplace not being psychologically safe or physically safe or whatever it may be. Yeah, as you say, they don't have as much, creative outputs, and they're not
Right.
as good at problem solving. But also what happens is there's this concept called, I've completely forgotten it now, I've gone blank, organizational citizenship behaviors.
Okay.
And what that is basically like a willingness to really kind of go the extra mile for your organization.
Oh, yeah, like to buy into the organization's mission so much that
Yeah, yep, to like,
the
do a bit
organization's
of extra stuff,
yeah.
and what happens when people are depleted, and it's especially seen, when people aren't feeling secure in their jobs or, people aren't feeling happy or comfortable in their jobs. Those resources are depleted and they start to go inwards and just really focus on themselves. They stop worrying about their colleagues.
Sure.
They stop worrying about the organization's mission. They're just like, I've just got to focus on what I need to do and that's it. And then I go home, and because they're trying to keep hold of their resources. So yeah, it is certainly in a company's best interest. And this is why the big companies of the world like Atlassian and Google and things like that, they do well because they do really try to cultivate an environment where people can thrive and they can bring their best selves to work and allow them to kind of fill up on those resources so they can feed it all back in. Because otherwise, as you say, you're not going to grow. Maybe you keep ticking over, but you're not gonna be getting any bigger. And that's the thing when businesses say like, oh, we can't afford this, it's too expensive. It's like you're just thinking too short term here. You need to think long term. If you want this business to keep growing, you need to invest in your people through different programs. And there's been research done on like well-being programs and stuff where they looked at companies trading on, I think it was the NASDAQ or the ASX or something like that. And they're like companies that have really decent well-being programs are more likely to actually trade well in the stock market than those that don't. So it's all out there. There's a lot of studies on like return on investment and things of investing in your people. But it just comes down, ultimately, it's like, just uncouple it from this scary, like, oh, psychological health and safety or mental health or whatever you want to talk about. Uncouple it from that and just think this is good business. If you're a good business leader, you need to do this thing if you want to continue for your business to grow. So
Well, that's just
yeah,
it.
it's just a smart business decision.
Yeah, exactly. I mean, yeah, I agree with that 100%. So, well, as we're not quite to the end of the segment, but I had something cool that I wanted to share with you that
Yes.
sprung to mind when I was reading your notes here. But it goes back to your first point where you were talking about how it's just the right thing to do, like creating this workspace is just the right thing to do, and that how we spend so much time at work. And it made me think of this quote, and I had to look it up, but it was actually from Mother Teresa. But
Yeah. No.
this quote where she said, "If you want to change the world, go home and love your family." And I thought, nowadays it should really be, if you want to change the world, go to work and love your coworkers, your boss,
Yeah.
because really you spend, if you really thought about it that way, that is where you're going to change the world most likely. That's where you're spending all your time.
Yeah.
You spend more of your working, at least Monday through Friday, say on the norm. You're spending more time at work than you are at home.
Exactly.
So,
Yeah.
if you want to change the world, start changing your workplace.
I like that.
Yeah,
That's a great tie-in. But it's true, isn't it? It's like
yeah,
I can remember years ago, like because I loved, the one of the bank jobs I had. I loved it. I had such fun there because
yeah,
it was a good culture for a time before things changed. But
yeah,
yeah, it was during those times I loved going to work. It
yeah,
just got me out of bed and I was excited and I was making good changes.
yeah,
But that was the thing. I can remember my wife at the time being like, "Oh, you're always at work. Why do you care about work so much? We work to live." And then I was like, "Yeah, but like she almost had this kind of this view of the world, which was like, just you can have a crappy job,
yeah,
because it's fine. You've got a life to live on the other side of it." But I
right,
kept thinking, no, you spend most of your life at work. Why
right,
would you want a crappy job? And accept a job that's not growing you in some way.
exactly,
It is going to affect you on the other side. So have a
right,
good job. And that's the biggest thing. Businesses don't need to look after people's mental health or stop them from getting a mental illness. Their only job is to create a psychologically safe and healthy work
right,
environment. That's the
right,
extent of what they need to do, which will then, cultivate thriving people, really.
yeah,
Hmm.
right.
So there you go. I've said a lot. Sorry. You see what
No, I
happens
like
when
it. Hey,
when
I
you turn
like
the tap
listening to
on?
it. I've been waiting for this one. People don't know, but I've been waiting for this episode because I know Adam's been studying all this, and I've been waiting to hear all this. So it's fun for
Yeah.
me. So
Yeah, it's good to talk about.
yeah,
So,
yeah. All right.
all right. Next
Next
topic,
question.
which is I'll hit start. What does a best practice approach to improving workplace mental health look like, and why is this framework so difficult to implement? So there's lots of different frameworks out there, and as I was saying, there's not a lot of concrete regulation or legislation out there. So in lieu of that, lots of different like voluntary guidance frameworks have been developed over time, and there's papers out there. There's one from 2017 that actually looks at workplace mental health guidelines and kind of assesses their comprehensiveness. So that's a
Okay.
good one to look at because it's a bit old now, but you can see how many different guidelines were created. But the framework I'm talking about, which has been tested, quite rigorously now, I guess, or has kind of come up against a lot of scrutiny and come through, is what we call an integrated approach to workplace mental health.
Mm-hmm.
And that's from a number of authors from Australia. A man named Tony Lamontagne from Deakin University,
Okay.
who is an amazing, amazing brain. Like Tony just knows so much about the topic and has just really helped me a lot, especially recently in fleshing out my first publication.
Oh, is that who you
Because
talked to?
yes,
Okay, I
yeah,
got you. I didn't make that connection. Okay.
yeah, and he's just been very, just a very amazing, human being and kind of helping me craft this paper. But basically, what this framework looks at is three overlapping threads, and it talks about how like interventions in general have really evolved through three different disciplines, being public health, psychology, and medicine. and how, they all have great merits and they're, very impactful. Some have differing degrees of efficacy, but, we need an approach that combines all of them together, and that will give you the best outcome. So those three threads, you've got the first one, which we would label as prevent harm. And that's all about identifying and controlling work-related risk factors to psychological health. So what that's about is just kind of looking at what are the components in your job design that have the risk of causing psychological or physical harm to someone. So if I'm to give you an example, it could
that was
be
going to be one of my questions.
being like, so like a business that has really high job demands, so we've all been there, I'm sure, in the work that you used to do and what I do at the bank, high job demands. But, if you don't have an environment where, you have some control over your work, you don't have some good support from your supervisor or good support from your colleagues or the resources to do that job, quite easily that can really overburden you and start to cause you a lot of stress and not good stress. And that's what can actually lead, if continued over time, that can become a hazard. So this first component is all about, and it's not an easy component by any means,
but it's hard to visualize, isn't it?
And that's a big thing to realize. It's all about risk assessment at work, but like doing a physical risk assessment is a lot easier than doing a psychosocial risk assessment, as we call this.
Okay.
So a physical one, you could say, I'm working in a lab. I know these chemicals are really hazardous and that if somebody spills them on themselves or whatever, they could get really sick, blah, blah, blah. So you can have controls in place to say, all right, we need to know who has access to these, where can we put them so they're safe and lock them away, da, da, da. So that's how you can control that hazard. But these other hazards differ from person to person, so it could be Amanda loves, a job that she's absolutely, and I know this is certainly not the case because you and I are the same, a job where you're constantly overburdened and exhausted. Maybe you just love that feeling.
Love it.
But, for me, maybe I don't like that, so we differ. And that's the nature of all this, is that what might work for you might not work for me.
That does make it really difficult.
Yeah, so that's the difficulty there. But it's all about controlling those hazards and going, okay, what can we do there to make sure that they don't have a negative impact on someone? So that's one of the components.
So it's
sorry.
Sorry, just to clarify, because I think what I'm getting from it is it's more than you're kind of trying to prevent barriers from people getting, I'm not saying this right, prevent barriers that would pop up that would keep people from being able to do their work, basically.
Yeah, that's it. It's trying to create an environment where, people aren't going to become overburdened or, just trying to acknowledge, okay, well, what is it in this work that could run the risk of, burning people out or overburdening people?
Yeah.
And, it's not always easy and there are a lot of different factors that you need to consider. But if you get those factors right, even though people are so variable and individuals are all different, for the most part, you're going to create a pretty decent strategy that'll set your workplace up well. So that's the foundation, I think, is that, controlling those hazards just so they don't overburden people. The second thread is from positive psychology, and it's about promoting employee strengths and positive capacities. And that's really important. Positive psychology is probably the newest kind of out of these three disciplines that I'm going to talk through. But it's all about, understanding, okay, so what are Amanda's strengths? Am I utilizing, I don't know, her creative writing skills or something in the work that she does or in your chartered accounting role? What are the things that you were really good at that I could get you to focus on? You also enjoy those things more, so you're therefore going to be more productive versus going, I know Amanda doesn't like doing these components of the role, but, she just has to do it. It's just part of the job. Whereas, that Pete down the, hallway, maybe he's really good at that thing, but he's also doing the thing that Amanda's really good at. So it's just understanding what are your employees good at doing, how can you kind of leverage those strengths in the work they do? Because then they're going to enjoy it, and you'll probably get a better output than if they didn't enjoy it. And at the same time, it's about understanding that well-being piece, in this discussion of mental health, to say that, if you can cultivate people that are really happy and thriving, and there's so many components to that, it's going to be good at work.
Yeah.
So, so far we're looking at preventing those risks, but then also really just leveraging, and there's so many other components to this promote the positive part, but, leveraging the positive capacities of work and bringing the best out in your employees.
Mm-hmm.
And the third component, as you can see, there's a lot to it,
yeah,
is responding to mental health concerns regardless of cause. And that's from the medical approach. That's when somebody is really struggling, and you might need to provide some job accommodations to help them out. Or maybe they've left work because of psychological injury, and you need to try and get them back to work as soon as possible. But how do you do that? Because maybe they're really nervous about coming back because their colleagues might, criticize them. Oh, I can't believe you're not at work because of your depression or whatever. Other things like people's level of mental health literacy. Some people might fear depression or fear anxiety, or be worried that if they talk to somebody about these things that, what's that going to do? Am I going to get in trouble? Or, I don't feel comfortable.
Lose their job, like they might be worried. Yeah.
Yeah. And but the really important part of this is in the language of it, which is responding to mental health concerns, right? And so the word there is responding, and it doesn't mean that you need to sit down and have like a clinical discussion or sit down and do something really serious. It's just about responding to somebody. So you kind of, it's like I can pick up when my friends aren't feeling great. Amanda and I have had chats where we can feel our energies off and we'll just chat about it. So I'm responding to your mental health, concern, right? I'm not saying you've got depression or whatever, but you're a bit off. You're not yourself. So we chat about it. We're responding to it. And maybe that's enough to kind of pick you up and get you through the day. So those three threads are really about accepting that people, regardless of how great the workplace is, people are going to, break down and struggle because of things outside of work, whatever it is. Right. You've just got to combine these three things together and it creates a really good framework. But yeah, so I'm going to pause there because that's a lot of information. I give you an opportunity to ask questions.
Well, no, but I'm really starting to realize, how complicated of a topic this really is, because it seems so simple. And it doesn't seem simple, but I mean, when you say the phrase, okay, we need to create not positive, but a good workplace mental health environment. Okay, it doesn't sound that intimidating until you start really breaking it down. And like you said, it's the difference that because everybody's different. And so that is what makes it hard to create a framework. I mean, I can really see that now that you're talking through all this stuff. And I think it's probably, people avoid things that they're uncomfortable with. And it is uncomfortable. You're going to have some uncomfortable conversations probably at some point.
100%.
So I'm sure that's partly too why the employer, not just because the employers don't want to spend the money, but they also don't want to get involved in some uncomfortable conversations.
Yeah.
But again, then you're just kicking the can down the road, because then you're going to have the uncomfortable conversation of having to fire someone later or of them quitting on you later. So you're still going to have an uncomfortable conversation at some point.
Yeah, exactly right. Yeah.
I was wondering, so you did answer one of my questions already. So this framework, though, so the purpose, just to kind of clarify, the purpose of it then is to bring the three disciplines together, because and those were, let's see, medical,
psychological, and and psychology, and public health, like OH&S. Right. Yeah, OH&S stuff.
I couldn't remember so that's the purpose of the framework, is to bring those three together, because that's the most effective way to address the issue. What does this I'm trying to picture, what does this framework look like? What kind of format is it? Is it like an operating manual kind of, or like an HR manual type thing where they would actually outline everything?
And that's a good question too, right? Because the first thing I'd acknowledge is this is best practice. So, like, if there's any, like, HR people or anyone who's kind of sitting there going, "Oh man, it's too hard, I'm not going to do it." It's like, this is best practice. If you want, like, to create, to get to that stage,
Yeah, this is the best. Yeah.
Yeah. So ultimately, you might be doing things that are really effective. You might have a really good EAP program at work, or maybe the way that your senior leaders at work talk about mental health and the struggles with COVID and stuff. They could be doing those things, and they could be really effective and making some difference. But yeah, and it's a good question in terms of how this translates.
Yeah.
Because it's going to be different depending on whether you've got a large organization, a medium organization, a small business. A small business, like a little, I don't know, a little fish and chip shop down the road with 4 employees, you're not going to need some big, giant strategy. It might just be about understanding this framework and the different things. How could you leverage your employee strengths? And it could be, all right, I know Kate in the shop is really good at serving customers. She loves talking to people.
Yeah.
She hates being behind the, she hates preparing food though.
Right.
It's all right. Well, why don't we leverage her strengths and get her facing customers? Whereas we know Paul hates people. So maybe Paul should be cooking the chips today, right? So something like that. And then, from that, prevent harm. Okay, well, we know when it's footy season, it's really, really busy. And we're going to have, a huge amount of customers coming through here. And it might, the guys might get stressed out. So how can we consider what are the components of this that I need to manage? Maybe at the end of the day, we need to sit down and have a chat. How's everyone feeling? Or make sure people are taking their breaks, or we all go out for a beer and just relax afterwards, or something like that. And then with, down the other side with the responding to mental health concerns, it's like, it's about having a chat. I've noticed Paul's come in today, he's not himself. Just have a chat, because you're in close proximity, because it's a small business. It could just be about chatting, are you going okay? Do you need anything from me? It doesn't have to be these high and mighty giant corporation programs. Yeah. Whereas in a big business, 55,000 employees, it's about building it into your your OH&S system and strategy and policies, and kind of, there's some other really good kind of systems out there that you could basically implement this strategy into. So it depends on the environment you're in, but I think the first thing is to just make sure that you are chatting to your people, really, I think. So, if you're in a small business, chat to your people and understand, what are some of their concerns that you could act upon. Or if you're in a really big business, it's about talking to a range of people, like your HR workers, your work health and safety reps, the auditors, your staff members, your leaders, because these people will all give you the insights you need to start making change. Because I think, the last thing we want is people to get scared away by this and do nothing, because
for sure.
It'll cost a lot of money down the other side.
Right. Yeah. Well, I just realized we kind of transitioned into the last question.
Yes.
All right.
Okay. Yeah.
So I just reset the timer because we're already kind of talking about the last question.
Yeah, we are. That's right. So the last question.
Say what the last question was again.
It is, if an organization wants to implement a workplace mental health framework, where should they start?
Yeah, and that was not really my intention with doing that. But then all of a sudden I'm like, hey, we're already talking about the last question.
Yeah. We kind of had moved in there. That was pretty funny. I hadn't even noticed. But yeah, I mean, we've kind of touched on it a bit already. But for me, I think what it's about is just start having some discussions with key people in your business, and start doing some planning. So don't rush to do something. Yeah. I think it's really important that you spend time just consulting with people and understanding what you need. But at the same time, you need to do it based on evidence-informed practice. Because, I think what's really important is people shouldn't just put something in place because another business that they've seen has done something.
Got it. Yeah.
Because sometimes, and there's research to this effect, sometimes doing something, is not better than doing nothing. You could implement a program which maybe is really suitable for that business, business friend of yours. Maybe it's working really well for their business, but for yours, it could actually cause unintended consequences.
Yeah.
So you've just got to sit down and start to understand what's important for your business, and then you can implement the right strategies or the right interventions. But this framework, ultimately for me, because I'm somebody who just I'm all about, do the best thing, So once you know that there's this best practice framework, I think that's the best way to go. But it's not easy. So you might need to bring on board some consultants who can help you. Maybe you need to do, encourage your HR or work health and safety reps or key informants in your business to do some research and sit down and look over these things. But ultimately, it's a process. It will take time. It'll take time to see some good cut through and getting to the next stage. But I just think start where you are, understand what you're doing. And, sometimes it could be reinvesting something into another avenue. Like I think one of the most common things here is these employee assistance programs. And I'm not saying they're it's not a good program, but in my experience, it's kind of like having
unemployment.
It can do a number of different things. Like it could be, it's usually like you get a number of free sessions with a counselor or a psychologist.
Okay. I see.
Yeah.
Okay.
And so the business could say, all right, we'll cover the first 6 sessions for you, and then we can go from there. And they can be good, but they're very much used in a reactive capacity a lot of the time. And this is based on my experience, where I was a manager. One of my staff members was struggling. We'd have a difficult conversation, and then I'd give them a card, like an EAP card, and say, hey, don't forget, you can call EAP if you're struggling. Now, that's very reactive. We've kind of, the problem's already come and gone, and you're already now just trying to get someone to put a Band-Aid on it.
Right.
But never in this workplace that I was in did we ever sit down and go, well, what kind of got him to this point where he was really struggling? Like maybe we're not leveraging his strengths. Maybe he's really tired because of his, external circumstances. Maybe the work is just draining him. There was never that proactive discussion. So, and you can use EAP services proactively, to, have people chat before they kind of get to that point where they're struggling. But I just think people just need to be aware of what they're doing and make sure that it's informed. It doesn't have to be a serious, employee survey or like some in-depth interviews or something. It can just be some chats where you just, start to talk to people and understand how they're feeling, because that's how you bring about the greatest change. So I don't think it needs to be too complicated. I think if you're really serious and you think, I want to create the best and, most psychologically safe and healthy workplace possible, all right, it's a big mission, but if you're keen to do it, frameworks like that integrated approach and other different frameworks around the world, get on board with those, because those are the ones that will help really drive your strategy, I think.
Yeah, that makes sense. I can see how it would be really easy. Not that it's easy to do, but it seems like it'd be simpler the smaller the company is, because it's just easier. One thing, is easier to get buy-in from everyone. If you're the owner and you're the manager and you're everything, it's pretty easy to get buy-in from yourself that this is a good idea.
Yeah.
I can see, and that this is how you're going to operate your company. But then the more people, like the more senior level managers you have, or whatever you want to say, I think the more difficult it gets, because you're going to get some of those. I can see that actually being one of the biggest barriers to getting something like this in place, is just the fact that if not all of your senior level managers are on the same are on board with this and they don't all buy into it 100%, it's not going to work because you're going to have different departments doing different things.
Yes.
When they're all together, they're all acting like they're all doing what they're supposed to do or whatever. But, then when they each go back to their own little departments, each little department is not operating in the same, and they all affect each other. I mean, even though I'm working for a different senior manager than you, our departments still have to interact at some point. And so they see inconsistencies. And so that's where I can see a lot of the barriers and the biggest complications coming.
Well, that's a really good point. That I completely forgot, that is kind of contained within that best practice framework.
Okay.
That it talks about the importance. So thanks for bringing that up.
Yeah, I did that on purpose, of course.
Yeah, I know you did. That's how informed she is, everyone,
Yeah.
But you've got, you need to have an organizational level framework, like a department or team kind of framework, and then individuals. Because, those three things,
Yeah.
because, as you say, like a department or a team might do it differently to another department and team. And that's where things can become unraveled. Because, so say, for example, the last business that I was in, this bank, I guess like the senior leader or, the executive seemed to be a pretty, I would say a very good leader. Okay. But I just think a lot of those behaviors or priorities started to dilute the further down you came down the chain, which is why, I left I left the business unit I was part of because my senior leader, had no interest in this stuff. She just wanted you to make money. She just wanted you to sell a lot of mortgages and a lot of products. In terms of people and cultivating a good, people culture, couldn't care less. Okay. So that's where you need to have, and again, where the complexity comes in. You need the organizational culture and framework and vision to be really in line with this. But then you also need to make sure that there's no break in the chain because, there will be people that bring in their own, maybe because the senior leader, like the one I had, maybe she just didn't feel comfortable talking about mental health. Right. Maybe she'd grown up in an environment where that was never part of the conversation, but she felt really confident with sales. So quite easily, maybe there's no ill intent there. Maybe it's just I'm comfortable with this, so that's the priority. But that's why it's important that we identify these breaks and say, right, let's test out people's level of knowledge on mental health. And then that's where you go, oh, you've got a very low level of literacy. Well, that could probably cause you not to prioritize this or feel uncomfortable. So we need to put something in place to help you. So, it's complicated because, you've got individuals and we're all different. You've got teams that are all different. You've got the organization, which is a big beast to kind of tackle. But if you can nail all those things across those three threads,
if you can nail all those things, I mean, no problem.
Yep, just sort all that out. You'll be fine.
Yeah, exactly. No problem. I know. But I mean, I'm just thinking, like in your example of someone who's just focused on sales, is like, well, I'm sure that's what she was told was most important, or maybe that's what she has been. Maybe that's what she's been praised for.
Yep.
Is her ability to bring in sales or whatever, close deals. And that's what she's been praised for. And that's the only thing she's ever been praised for. So of course that's the result she wants to deliver.
Yeah.
I mean, obviously there's financial reasons. Maybe she had a bonus. And that's the whole other thing too, is how these bonuses are structured. Because a lot of times we get into the financial side now. That's my world.
Yeah.
Because a lot of times the bonus packages are structured so that the bonuses are based on profits. They're not based on, and profit is not an indication of how well a company is doing.
No.
Especially if you're looking at the profit for only a quarter or a year, that doesn't say anything. Any company can have a good year or a good quarter. That doesn't mean they're healthy.
No, exactly.
And so, I mean, it's the same. That's another big part of it, though, is that's such a big focus. And so you're trying to, another challenge, I'd say, for people like you out there who are trying to make this change in the work environment, is you got to shift everybody's thinking over. from just
Yeah.
thinking about the dollars to thinking about long-term sustainability.
Yeah. Yeah. And, it's like, it's also just saying, like, right now, because we don't really have any firm legislation, there is no kind of consequences in a way.
Yeah.
Because sometimes people or businesses respond well to the stick. They need the inspector or the auditor to come in and smack them on the hand and say, you're getting it all wrong, and here's a fine. And then they go, oh, no, okay, I better do something about it. But it's quite a complex issue, so there really isn't. But in Australia, I'd say in the next couple of years, we will have regulation.
Really?
And I tell you what, there will be a lot of people coming out of the woodwork going, oh my God, I need to know what to do. So it's like, get a head start on it. Even if you're in America, like as you said, like I can't see anytime soon America adopting any legislation. Just doesn't seem to be anything in the works. Yeah. But, it really is understanding. If you don't, like, and pardon my French here, but if you don't give a shit about your people and they are just means to an end for you, okay, that's fine. Like maybe based on the other content we've discussed on the other episodes, you're probably not a great human being, but that's okay. You know who you are. You just don't give a shit about people. But there is, like, if you only care about money, this is the way to get more money.
True. That's true.
You might not see it because you're just used to looking at spreadsheets and you just see, in the loss
you're
section.
being evaluated on, though. You're being yep.
You just need to understand it's like, if people are a means to an end for you, you need those people to be in a thriving state that they can really bring their best selves to work. They will get the best output for you.
Right.
So that's why it's like you have to look after them. It'll be the same thing. You can tell everyone you love them and secretly deep down think, I don't give a shit about you at all. This is just to get more money. And that's fine, but that's how you're going to get the money ultimately in the long term and make it a sustainable business.
Yeah.
So, I'll put a disclaimer and say I've only done this for a year. So there's a lot to learn. I think what's humbled me is that I'm, talking or listening to a lot of people that have been doing, looking at this topic for many years. Mm-hmm. And I'm learning every day. So there's probably a lot of holes in some of the things I've said today. I'm sure I could have expressed it better. But ultimately, just if you take anything out of it, it's just about, start having some discussions with your people. And it doesn't need to be medical. This is not a medical discussion. Yeah. As soon as you medicalize something, it becomes scary. It's about being a human being and just kind of just looking at how you can look after people better, So we'll see what I say in a year or 2 years time.
I know it'll be interesting to see how it comes back around. But
but the one good thing out of COVID is that it is really underscoring how important this issue is. People are struggling. Our leaders, like political leaders, are burning out because they're exhausted from all the work. You've got healthcare staff who are really struggling because they've got a lot of demands on them at the moment. So it's just really shone a big light on there, and more people are talking about it. So it's we've just got to get our heads around the complexity of the issue and start taking action, I think.
Yes, and just make small steps, one step at a time, right?
Exactly.
That's all you can do. Yeah, exactly.
So, but that's it for me.
All right.
Talked enough.
Well, I know, but it's like it really is important to see how complex of an issue it is and why we avoid it so much. I think that's another important thing to understand is why we avoid it, so we can stop avoiding it. So that was awesome. Cool. That was fun. I'm glad I got to learn all about that stuff. So
thank you for giving me the time. So
all right. So
I'll wrap it up, I guess.
Yeah, formal wrap up here. So if you made it this far, you're still listening, watching, whatever, we really appreciate it. And you can show your support by liking the video or sharing it or the audio or whatever, if it's a video or audio that you're taking this in on. So share it, like it. And then, of course, you can head over to Coffee and donate as little as $1 to help us keep improving the show. You can reach us at cheers to not settling at gmail.com or on LinkedIn. And I think that's about it. So we'll just say until next time, cheers to not settling.
Cheers to not settling. Bye.
Bye.